COVID-19, Africans cannot contract the virus.
COVID-19 can affect anyone of any race, nationality, or skin color, as we have seen in many African countries, including the Gambia.
Myth 2.
Is it true eating garlic can help you prevent getting COVID-19?
No, there is no evidence for that. Keep washing your hands. Maintain at least 1 meter physical distance from others and use the preventive measures to protect yourself and the people you love.
Myth 3.
Hey, did you know that Gambia is spared? COVID-19 cannot survive in hot climates.
Actually, COVID-19 survives in all climates, hot or cold. Look at our neighboring country. We have to continue washing our hands and avoid touching our eyes, nose, and mouth.
Myth 4.
COVID-19 that only affect the urban areas. We are not affected here in the rural areas.
No, not all cases are in the combos. There are confirmed COVID-19 cases in other regions of the Gambia.
Honorable Ahmed Lamin Samate, giving you an update on the situation and as well as also telling you some of the responses we are doing as a ministry with support from our partners. The 113th National Situation Report, since confirmation of the first case of the novel coronavirus COVID-19 in the Gambia on the 17th of March 2020, when the country reported the first COVID-19 case. As of yesterday, the country reported 3 new COVID-19 related deaths, bringing the total number to 19, which represents a crude case fatality ratio of 1.7%. Additionally, the country also registered 155 new cases. 155 new cases registered, which is the highest reported in a single day, thus far taking the total number of COVID-19 cases ever confirmed in the country to 1,090. 26% of these are healthcare workers, mainly from Pakala, Bundum Maternal Child and Child Health Hospital, and Edward Francis Small Teaching Hospital. Unlike the previous sets of reported cases, which were predominantly asymptomatic, over 60% of the new cases are symptomatic, with many presenting with loss of taste or smell and intermittent coughing. 16 new recoveries recorded, bringing the total number of recoveries to 146, which represents 13.4% of confirmed cases. 360 new laboratory test results received, 122 from MRC the Gambia, and 238 from the National Public Health Laboratory. Of these, 184 tested negative, both new and repeats, 156 returned positive, 1 repeats and 155 new, and 20 tested inconclusive or probable for COVID-19. Whereas 29 patients were newly taken into quarantine and no new discharge were made. The country currently has 485 people in quarantine, 925 active cases, 112 probable cases, and a crude case fatality ratio of 1.7%. Globally, since 31st December 2019, as of 6th August 2020, a total of 18,965,762 cases of COVID-19 which are in accordance with the applied case definition in the affected countries, have been reported. Of these deaths, 710,287 were registered, and 12,156,537 recovered from the disease. Senegal recorded 10,538 confirmed cases, 6,988 recoveries, and 219 deaths. Currently, we have 485 people in quarantine. A total of 7,817 tests were conducted. And 1,090 are positive. 146 recoveries and 119 deaths. A total of 1,682 people completed quarantine. 1,681 out of 1,731 targets. These were contacts that were traced, and 310 people completed follow-ups, which are asymptomatic with travel history to affected countries. Summary: about 60% of the confirmed cases were males. About 65% of the confirmed cases are below the age of 40 years. 3 main waves of infection occurred: the pre-airport closure wave, the importation from Senegal wave, and the intermittent airport reopening and loosening of the restrictions wave. And within the last 10 days, there has been over 100% increase in the number of confirmed COVID-19 cases reported by the country. Currently, the ministry is working on various strategies, and key among them is a strategy to ensure that mandatory wearing of face masks, preferably made of fabric, when in public, is one of the strategies partners are working towards so that people can be putting on face masks. There is continuous public education on hand washing with soap and water, or use of hand sanitizer regularly. We also campaigning on avoiding where necessary crowds or observing physical distancing, and as well as avoidance of handshaking, and also avoidance of close and ill-ventilated places. We are also working on various strategies, but as currently, as part of our next steps, the ministry and its partners will intensify community engagement and sensitization on the importance of safe and dignified burials. We also will ensure that infection prevention and control measures are strictly adhered to in all public and private healthcare facilities in the country. And the ministry will also continue to provide adequate stock of PPEs to all health facilities in the country, and as well as healthcare workers also will be trained on COVID-19 preventive measures, including the donning of appropriate PPEs at all times. The ministry also would like to appeal to the general public to adhere to the precautionary measures, and as well as for them to also adhere to the state of public emergency regulation. And we also want to thank the public for the cooperation. Over the years that we have been working together, we have really worked closely to sensitize the public, and the public really were very cooperative. Doing very well. They started implementing the state of public emergency regulation, and we also thank the public for cooperating with the security personnel. On this note, I thank you all for your kind attention. And I wait for your questions and answers to be given to you as quickly as possible. I thank you.
Okay, thank you, Director. So I will moderate the question and answer session. Now I will give the floor to Lamin Fall. I can see whoever wants to ask a question, you can please raise your hand. So Lamin Fall, you have the floor, please. Thank you.
Hi, thank you very much for granting me a chance to ask a question. I'm Lamin Fall, working with Paradise TV. Director, I would like to know where is the sample taking currently being done for testing? Thank you.
Yeah,
thank you very much. Thank you very much. That's a very important question. What happened is the intention was to start the sample collection at Ndebar Clinic. It started for 1 or 2 days, and then we realized that we have a sample of about almost 900 samples, and this is almost a backlog of samples which need to be completed. As a result of that, sample collection have been put on hold for now until maybe towards the end of this weekend, when all the samples that have been collected are also analyzed and also results are given to people, because many people are also waiting for their results because we have backlog of samples that have been collected previously. Thank you.
Thank you. Now I have Africa.
Please, just a follow-up question.
Okay,
why
quickly,
why the delay in conducting tests on the samples that have already been taken?
Okay, Director, he's saying why the delay in conducting the test of
thank you. Actually, it was not a delay. It was not something that it was deliberate. No, I think you are aware of our situation. Our key people who are collecting samples in Kotu at the National Public Health Laboratory, almost 50 to 60% of those people have already been positive with COVID. So that has been posed a big challenge to us, and we had to strategize the little human resource we had at that time. And that was, and the demand for sample collection was definitely high, because at the beginning, people were not very much concerned with testing, but now everybody is aware of the importance of testing, and that's why many people turn up, and that's why we are having the volume of samples have increased, because many people are also turning up for testing, and that is really encouraging. Yeah, because we want people to come out, and they are now coming out. But because at that time, we were also very busy, working very hard. All our staff, most of our staff were down, and then they were, positive with COVID. And then at least, thank God, many of them are recovering, and they are now reporting to work, and work have started. So that's why I want to clear with the backlog we have, and then we can start collecting samples again. Thank you.
Thank you, Director, and thank you, Lamin, for that question. May I now have iAfrica? Okay, it looks like iAfrica is off. Now we have Taranga FM. Yes, Lamin, you have the floor, please.
Yeah, okay. Assalamu alaikum. Maa ngi nuyu ñëpp. Suma question bi ci olof laa ko bëgg a laajte pour Taranga FM la. Mooy condition yi nga xamante ne ñu ngi leen quarantine, jot nañ information ne yenn ci noos yi ñu ne condition yi ñu nekkee foofu noonu nekk na ci anam boo xamante ne bu métti la. Bëggoon nañ directeur bi comme c'est moom am na xam-xam ci mbir yuy xew mu leeralal loolu noonu askan wi jërëjëf.
dégg naa sa laajte bi li nga laajte ni man suma boppa fana bu ma ko yëg yaagu bu ko dañ ma woon ne am nañ kuñ interview radio, waaye nag buñ ko interview nag ñu ne dañ ko woon am nañ ay jafe-jafe, waaye nag balaa maa tontu si loolu foog man tam man laajte ñoo xam ne ñoo nekk si quarantine center, te xam nga ne waxoon naa ne fana am na ñaari fan yoo xam ne man tam ñoo moo liggéey dama feebaroon teel a soog a ñëw rek ma ne xaaral ma ñëw seet fii naka la mel, waaye ma ñëw fekk fi tam liggéey baa ngi bari, waaye nag moo tax mënu ma woon a laaj, waaye xam naa dina balaa ma wàcce dinaa dem jaar quarantine center man laajte la ñooñu naka lañ meloon bala maa ñoo tontuwaati waaye di moo gën a may components. We can sensitize communities on the observance of precautionary measures, but this time we want to again sensitize them and engage them on barriers because we have a challenge. Like where Red Cross will go and bury certain family members, we have a challenge there. That's why we want to focus on that particular area. Another time, we do again the same community engagement and sensitization on a different topic again, but the same strategy still remains. I'm missing that point. We also talk about infection prevention and control. That one is a continuous one. It will start from now. Every day we have to train because every day we have new people joining us, for example. So we have to make sure that training is a continuous process. Different components. We want to engage on when our family members we have that's why we focus on a different topic again. We also talk about infection. Every day we have anyone who is also adequate stock of PPEs. In case it is not there, it should be available. If it is there, we make sure that the supply will not be interrupted. It will always be available. So that's why some of these recommendations, you see them coming, but it has to be, it's also a reminder to authorities and administration to make sure that those ones will be there. When they see it, they make sure that we don't run out of stock for PPEs. And let me tell you, the PPEs, according to the logistic and the logistic manager, the logistic director, the PPEs will really serve us up to the end of the COVID period. So when people say PPEs are not available, perhaps they did not make the request and they didn't go through the right channel. But when they are requested, it will always be available to whoever needs it, or especially the institutions. That one is always very clear. So I want to make it very clear that PPEs are always available, and they are available in large stock at the moment at the Central Medical Store.
Okay, thank you very much.
Okay, thank you. May I now have Gambia Talent?
Yes, thank you very much. Director Njai, I have only one question for you. It's Isa Tukuli from Gambian Talents TV. We had an interview with the Red Cross Society yesterday, and from what we were told is they buried more than 20 bodies. So why is it that the Red Cross Society are burying non-positive bodies? And don't you think these bodies should be given to their respective family members for them to be given a proper burial? So why is it that the non-positive COVID-19 bodies are also given to the Red Cross Society for burial?
This is news to me. I've not heard about that. But if that is the case, we will find out and see what's the rationale behind that. And then perhaps those people are being given the record, perhaps they could be exposed, or they could have the contacts, or maybe they are suspects. It's all possible, but that information, I will have to contact the head of the burial team, and I'll pose this question to the individual, and any response I have, inshallah, tomorrow I'll give you an update on that one.
Thank you, sir.
Thank you.
I want to follow up on that. This is Pa Usman Juf, and I'm still part of Gambian Talents. Can I go ahead? Hello,
yes,
can
go
I?
Ahead. Go ahead.
Yes. Mr. Njai, as you just responded to Isa too, somebody else a couple of minutes ago asked you another question, and you gave them the same answer, which is that you will go find out and come back. How much of coordination is happening within the ministry? If you, who is supposed to be the custodian of information, don't seem to have the answers to a lot of these things that have been asked, that you have been asked. Because if you come and you have a press conference, if 5, 6 people ask you questions and 3 of those questions you are not able to answer, how much coordination is happening within the ministry? My other question would have to do with the closure of the borders. Just last week, We have a team that went across the length and breadth of the country from Basse to Koina to Fenye to Kirpate, Karang, Jiboro, everywhere. And our teams were actually able to enter in and out of Senegal and even interview people. But for the past few months, the ministry and the government have been telling the Gambians that the borders between Gambia and Senegal are closed. We are not even talking about the porous borders here, but the regular borders. Our people have been able to go in and out of Senegal to come in. But the ministry and the government have been telling Gambians that the borders have been closed. Our land borders have been closed. They have been closed. They have been closed. Is this just things you are putting on paper just to tell the Gambians or assure them? Or are these things that really happen? Because we have evidence that the borders, people are actually going in and out of Senegal. And right now we are talking about a big surge in the increase. And in fact, people just came back from prayers. I have people that went to Senegal for prayers and they came back. So what can you tell the Gambians about the closure of the borders that you, the ministry and the government have been assuring the Gambians throughout this period? Thank you.
What they told me, and I come back and tell them the reality. Whether it is the right thing, I will tell them. Whether it's the wrong thing, I will tell them. So I think it's important that one should be very happy with that. You ask something about something, you ask somebody about something, and the person tell you, well, I have to go and find out and come and give you the truth. And I've been doing that. Anytime I say I'm going to find out, I come back and tell them. So no one can push me to a corner and no one can push me to say something that I'm not supposed to say. Thank you.
Thank you. Again, Fal's son is still up. Is that this Lamin Fal?
Thank you. Yeah, you can go ahead. Anyone who want to ask again?
Yes, I do. If nobody else, I was just giving others chance, but if nobody is, I have a follow-up question, unless my colleagues have something to ask.
Go ahead.
Yes, just to piggyback on what you've just said, it is a routine that when you are asked questions, oftentimes you say, we'll get the information and get back to you. So to come back the next day and there's another press conference and you said the same thing. The question was, is it not possible for the ministry to gather all the necessary information at once? That way you can present it to the public, rather than every day when you are asked, there would be certain areas or certain issues that you would not be clear about and you will have to go and get the information and come back.
Okay.
I think you are muted.
Okay, Mr. I don't know, Mr. Juve. Mr. Juve. Mr. Juve. Hello?
So I myself, just to make sure that I am not interrupting. Go ahead.
No, it's okay. What I want to tell you, you know, this work, one have to be very much mindful whatever you say, because what happens is like this press conference are never planned to say, when we go to a press conference, we will do this, and then these are the questions we expect. These are open press briefings. Questions can come from any angle. Certain questions you can answer them at spot, you have the information. Certain questions will come at a time that you don't have that information, and you cannot commit yourself and say something about that. So you have to wait until you get the information. You come back again, they ask you, you repeat. None of your people will ever tell you that I said something to them that I'll come back to them, I never get back to them. That has never happened. I want to make it very clear. Thank
Okay.
you.
Okay, if I can interject here, just to save time, maybe we can go ahead and allow other people to ask question, and this issue can be addressed later. All right, thank you. Can we have another? Is it Lamin Fall? I can see your hand still up. If no question, then I think we will throw the curtain here. It looks like we have no question, Mr. Njai, so please, you can close the session.
Thank you, Buba, for moderating, and I thank you all for participating, and hope to see you again for another update. Thank you, and thank you for your questions. I'm sorry if I cannot respond to you today,